When COVID-19 patients started rolling into the place I work at, what we started having was the difficulty and situation of being sure that we had enough critical care trained respiratory therapists to take care of those patients. And the thing with COVID-19, these patients are complex. It's not a put them on mechanical ventilation and walk away. It's something that takes continuous changing of settings and altering settings. And some patients require different modes. And so really it's not only being a respiratory therapist, but it being that critically trained respiratory therapist that is, super important to taking care of this cohort of patients. The most rewarding thing about being a respiratory therapist is really seeing the difference that you can make in the patient care trajectory. One of the examples I give was from a couple of years ago where I was working in an ICU and we were rounding with the physician team. And we have a really sick patient and we're discussing about what we should or shouldn't do for the patient. And the attending physician turns to me and says, Daniel, what do you think that we should do for this patient? And I say, well, according to the Perceiva study, this patient meets indications for prone positioning. I think that's what we need to do. And he turns back to the team and says, well, we need to prone the patient. And I think what's really rewarding is getting to the level of having that respect from the physicians. Being a respiratory therapist is something that I couldn't imagine doing anything else. The combination of, taking care of patients, applying physiology that you learn, and then meshing the technology portion. I mean, you really do become the expert in all things mechanical ventilation related. And I couldn't imagine doing, anything else. It's something that, keeps you on your toes. You're always in situations where you have to think on your feet and really, try to figure out what is best for the patient. And being that patient advocate along with communicating with the nursing colleagues and physician team really does make a big difference in the care of the patient.